I think early on people probably feel some hesitation. We've all heard of the lean process and different companies and private sector and groups that are looking at gaining efficiencies. I think you have to work through that anxiety that this isn't a way to reduce staff or to reduce services. Quite the opposite. It's really looking to do more and become a better customer service to our general public. And I think that's the expectation that people now have. And I think staff in turn feel better about their jobs when they see that they're working for an organization that's continually trying to improve. I think that's it's just an environment people like to work in as well. We chose this for a couple of reasons. One is that we've had the general public ask us for this kind of information, both informally, and then we actually had people come and really contact their older persons, and their older persons on their behalf came to us and said, hey, can we do this, can we look into it? So we knew we had support from the public, we knew we had Common Council support to invest time into it. So it seemed like a natural one that impacted a great, it was something that impacted many of our resources. Our environmental health program is one of our main components that we do as a health department. So picking a project that impacted a large number of employees made sense. So it really came together that way. What we wanted to do is take our restaurant inspections, which are filed in file cabinets, and bring them out to the public.
We have not had a lot of requests for open records, and this is a trend that seems to be a nationwide trend of bringing the work we do to the public so that they can have an informed decision about the places they go to eat.
Well, with this project, I wanted to make sure that it was done in a manner that was going to not be confusing to the public, because that's who we're doing this for. We're doing it for the public. And I wanted to make sure that the reports that were put online are not going to be open to too much interpretation. We wanted to make sure we got the correct point across and not leave it subjective with a letter grade or just a raw score or anything like that.
Results-wise, they were phenomenal, just to see how many hits that we have had on the website every day. You know, I think originally we have about 5 requests for the restaurant inspection reports every year. The Post-Crescent response was really positive. They just did a little article in it in their blog section, and then I read down the comments on the blog from people that read the Post-Crescent, and all the comments were positive too. It looks like people are really interested in seeing the restaurant inspection reports before they go out to eat.
I think people are encouraged that health departments are doing quality improvement, and I think that the more we can share that news, that health departments are living organisms that are improving and helping improve the health of the community, I think that really helps educate the general public of what health departments do as well. So there's that secondary benefit.
It's an organized way of doing something good, and doing it right.
That there are valuable elements of it that you can apply to different projects. So again, like I said, I'm fairly new, just getting an understanding of some of that process, but I do think that it's something that interested to see it explored more and applied to other areas of public health, because I do think that it's general enough that it can, some of those principles can be applied. And I don't think it always has to be every time you have to incorporate all of the different elements, but that there are pieces here and there that maybe even on a small project can help you work through something to get everyone on the same page and moving in the same direction.
I think, having gone through it once and coming out with the product that we did, I can see, utilizing this in other facets.
I think up front it looks like it's going to take a little bit of time and it's going to be a process that everyone has to learn, but it's definitely worthwhile and you will see the quality improvement within your department.